Okay, it is Thursday, January 12th, 2023, roughly 5:30 in the evening. And this is the meeting of the Gloucester Board of Health being held in the Harbor Masters Conference Room. Before we begin, I should say that this meeting is being held consistent with Chapter 107 of the Acts of 2022, and the meeting will be conducted by remote participation. The public may not physically attend the meeting, but every effort will be made to allow the public to view and listen to the meeting in real time and participate when necessary. All votes taken on the board during this and future meetings, remote meetings, will be by roll call vote. If you're calling in on a phone, you can press *9. If you are watching on a computer or other device, there is a raised hand button that you can tap or press to request to speak. Please use either of these options during oral communications to be recognized to speak. I should also note that the order of the agenda can be modified at the board's discretion. First item on the agenda is to go around the table and, for the purposes of recognizing the board, identify yourselves.
Claudia Schweitzer, Vice Chair, Board of Health.
Joe Rosa, Chair.
Eric Kaplan, Board of Health.
Don Gannon, Board of Health member.
Jill Cahill, Chief Administrative Officer.
And I don't know whether the rest of the individuals would like to identify themselves quickly. Please just go around the table.
Cindy Junker, interim public health nurse.
Chelsea Hastings Walsh, Regional Prevention Director.
Bree Gray, Housing Inspector.
Jacob Taylor, Health/Food Inspector.
Liz Olson, Regional Prevention Coordinator.
Leslie Whalen, Title V Sanitarian.
Rosalina Castro, seniors on the Go Bus.
Thank you.
Lee.
Oh, sorry.
Leo Leary,
Lee.
Financial.
Marco.
So next, Marco, good to see you. Identify yourself.
Marco Palazzolo, Board of Health member.
Great, thank you. Next item on the agenda is public oral communication, an opportunity for the public to speak for up to 3 minutes on an item not on the agenda. Is there anyone?
I don't see any raised hands.
No, there, Marianne. Where'd she go? Marianne's raised, hand is raised.
Oh. Okay. She's allowed to talk.
Thank you. Marianne Albert Boucher, 93 Mount Pleasant Avenue. Good Harbor Beach is a jewel in the city, a natural asset and an economic engine, like a grand national park, considered one of the top beaches in America. Safety, clean air, and water are fundamental responsibilities of the city and the community. Last July, the city of Gloucester closed the creek portion of the Good Harbor Beach due to contamination of enterococci at a level exceeding 144,000 CFU.
Marianne, the Good Harbor Creek is going to be discussed.
Is it on the agenda?
Yes,
I did not see it on the agenda.
it's at the end.
So I may not read this. Is that what you're telling me?
No, that's outside the bounds of what public oral communication is.
Okay, well, I've already sent it in and spoke at the city council meeting. And I'm requesting a full report for that. So I will send you all a copy, and I hope that you take it into consideration and take it seriously. Thank you so much.
Thank you.
Thanks for your concerns.
Thank you.
All right. Next item on the agenda is the approval of the minutes of December 1.
I make a motion to approve the minutes of December 1.
A second.
Any discussion, alterations, changes? No? All in favor?
Aye.
Claudia, aye. Joe Rosa, aye.
Eric Kaplan, aye.
Don Gannon, aye.
And it's over. Oh, sorry, Marco, not used to being out there.
Can you guys hear me?
Yes.
Yeah. Yep.
Okay, good.
Committee reports. We're just gonna go through the list here. Food safety, Jake.
Okay, this month in December, we had 0 complaints, calls and investigations, which is a big plus. There were 32 inspections and one event. One event was visited. That was the Temple of Art tree lighting ceremony held on Middle Street. Basically, we're in permit season right now, just trying to go through get everybody their food permits, mobile permits, food retail permits. So going through everything on the viewpoint system and mailing all the permits and attached documents over to the permit holders and whatnot. We had 2 fires at a food establishment facility over the December. It was a wholesale in East Gloucester. So technically the state represents and comes down and does the investigation towards that, but they will be able to walk through and say, okay, you guys need to call the state back. So other than that, I accompanied Prevention Director, Miss Chelsea, to the Action Shelter. And we had a nice meeting with the director of the Action Shelter, a gentleman named Michael, just as far as what their regulations and everything are still in the COVID times and whatnot. We ended up going around and delivering a number of COVID tests to all the departments in the city pre-holiday season and whatnot. And that's about it for me.
Any questions? No. Housing, Bree.
All right, yep. So December was a pretty light month, just 7 unit inspections, and around 4 complaints / investigations. Only one of them being a housing complaint. The rest were general nuisance. C-Click Fix is now live for housing related complaints. So any sanitary code violations, construction violations like dust, asbestos, lead paint, and hotel motel complaints. People, general public can go on to C-Click Fix and input any complaints through there.
So is that evident on the homepage?
Yeah.
It's
Yeah.
easy to see, isn't it?
Yep, yeah, so it has like housing, health and housing, I believe is one of the titles of that, and then has it separated out.
Good.
So they can
That's
get,
great.
Yeah.
That's great.
yeah, so it's easier to track for us and be able to talk to them and show what the progress is and within the complaint,
Mhm.
which is really nice. So we'll be implementing more options for residents. So I'm working with Ryan, food like complaints, food related complaints, like food illness complaints, and just general sanitation complaints. So that's the next step for that one. So that's really exciting. I'm also trying to work on coming up with some kind of plan to expand reaching landlords about the rental dwelling certificate requirement. Just, I think a lot of people don't know about it or just need, to be updated on it, especially with the housing code changes that are coming. They're gonna be implemented in April. The state sanitary code has finally gone through some changes. Be updated as of April. So I think it's important that they know about the changes being made, but also just that they know about the rental certificate program in the city. So definitely would like some input on.
Yeah, so is there a notice in the paper? Put or?
I think they've done that in the past, but so that's definitely something we could do.
Do we have a budget for that? Is that,
We have them.
does anybody know? We do.
You can also use
So-
social media.
Mhm.
If you believe that that's useful for the public to be informed. I
Yeah,
don't know how many people see the paper, but maybe, I presume those things also show up online, do they?
oh yeah, they should.
And so we could also go on our Facebook page, right?
Mhm.
Yeah.
Yeah, I think the other challenge of it is those that just don't continue to get them to, and then that was the thing that we discussed is how to reach the ones that we know aren't submitting the required ones, and enforcement on that, I think is going to be a bit challenging with how many there are.
Really.
So that's just something. that-
These are the landlords.
Yeah, just for the amount of certificates that we currently have to what I'm guessing, it was probably a lot more than what we
Yeah.
currently have. So then I'm just trying to think about if we do implement something, what what that's gonna look like as far as challenges of sending out order letters for them to submit rental certificates and then following up. And so that's kind of a piece that I'm thinking about moving forward as well, how that would look.
I presume there's no history that we can look back on, or perhaps this problem has arisen because it's been ignored in the past. Is that?
I think that's a big thing. So I'm working on getting all the old files because I have 2 big filing cabinets with all the old rental certificates. So getting those uploaded into the Viewpoint system and then attached to their respective addresses and kind of see where we're at with that. Because I think a lot of those have gone to the wayside too of the old paper applications and then just never followed up on when they were due for renewal from a long time ago.
Do you know if we have penalties for violations in the code?
There is a penalty. I can't remember off the top of my head whether it's like $50 a day for not, or something. In past practice that I've noticed, just looking at documents online, it's been that they get sent an order letter and giving them a set time frame to apply for a rental certificate. So we're not like
Right.
getting any monetary fines for not having one up until that point or for forgetting or anything like that. So it's
So
just
the letter is the start.
the letter's the start date pretty much of that, yeah. Please get the application in and get your unit inspected.
That's right, that's gonna be a big job.
Yeah.
Because there's so many people who have like one apartment. that they
Right.
rent or whatever.
Yep, yeah, so that's just something in the works.
Yeah.
Marie, you mentioned there was sanitary changes to the.
Yeah,
Can you share with
so
us?
the state sanitary code, they've been working on it for about 5 years now, I think, the state has, and making updates to the state sanitary code. It's desperately needed. Most of the changes are just, they've updated language to make things a little easier for us to understand, which is good. So things aren't as vague as we're saying. They've had some other little changes that are like one of the things that I've been telling landlords, just to give them a heads up, is they're actually gonna have specific sizing for stoves and ovens and refrigerators. So I think they're just trying to move from like a lot of places in Boston have the mini dorm fridges and, hot plates. Like that's not gonna be allowed. They're gonna have normal size refrigerators, normal size oven and stoves. So that was just one thing that stuck out to me when they did an overview. I'm hoping to they're having an update, like a little one-day conference just to talk about the updates at the end of the month. So hoping to be able to go to that and get a good overview of what exactly is changing. It's a lot.
Good, so keep us appraised
Yep.
of your thoughts about that,
Yeah, we'll do.
what more we can do.
Yeah.
And-
Leslie.
Sorry, if you
sanitary.
wanted to,
Oh,
if you want to
sorry.
see the See Click Fix, I could share my screen if you want,
Oh.
if the members wanted to see it.
Sure.
It's up to you guys.
If that's easy to do.
Do you know how to let me, panelists, share my screen?
Share screen.
Let's see. I have host disabled participation hearing, so if you can figure it out.
Modern technology.
Exactly.
It's
Well, I
amazing.
figure it's a good thing for the public to see.
Yeah,
Yeah,
oh,
yeah,
definitely,
absolutely.
definitely.
If not, we can set it for next
apologize.
time.
It gives 3 choices: desktop, iPhone, iPad, and then camera. Those are the only share content.
And if not, we can just do it for the next meeting. Out of that one. Can you? Maybe, let's see, okay.
Bree, how often do apartments need to be inspected?
So short-term rentals are due every 2 years. Long-term tenants, it can go up to 6 years. Unless there's a change in tenancy past the 2-year mark, then they should be getting it after that change of tenancy. But really minimum 6 years for the long term.
Your office does that?
I do that.
Oh,
It's just me.
Great.
And I'll
Jake
go to
helps,
the
Jake
first
helps
screen
me
so you guys
sometimes
can
if
see.
I'm away.
Actually,
Jill,
I'll
you're
go,
hired.
I'll go home. Been doing it a little while. Let me see. Okay, so if you, for the public too, and for the board members, if you go to our city homepage, and you go to report a concern. It brings you to our citizen request, which is known internally, and I think most people externally know it as See-Click Fix. Use it for a lot of things. So one of our favorite pieces of it is that you start with where you are. So you don't have to try to guess. So we'll just say we're at 19 Harbor Loop. Confirm our location. And then you have all these choices, right? But the health ones are, as you scroll down, which I'm gonna talk to them about getting you guys moved up in alphabetical order, because I don't know why that happened.
Health and housing.
So there's health department, health and housing sanitary code, health and housing construction violations, and motel complaints. So we could say that TJ's not cleaning his bathrooms. And you could add a photo. So if there's mold or whatever they're looking for to come in, you can add that here, and then it goes directly through this system. And I believe Bree's probably the one who tags her, and then that way, so we have a whole customer relations management tool that sits in the back side of this, so that we can track
Yeah, it's great.
how the complaint, when the complaint came in, who handled it, how it was handled. And we can pull statistics to take a look at, and DPW obviously gets the most, so we can take a look at how many tickets have been resolved and how, and anyway, it gives us a lot of data on the back end that someday you guys might find interesting.
Yeah. Great, thank you.
I've used
Yeah.
it. It's very effective.
And the sanitary
Sorry.
code violation ones are they're private, so the general public can't see where they're pinpointing and see it. So the other ones are public that you can see that somebody, so you can see if your neighbor already complained about this trash that hasn't been picked up, or something like that, but those ones are cut off from view to keep them private. I just felt like it wasn't appropriate for them to be,
Yeah, that's great.
public, yeah.
Leslie,
Thank you. So,
you may have to speak up to the microphone to pick you up.
okay, so in your packet, you have my monthly report of activities. One thing that's new this month from last month is I've been looking at the subdivision plans. There are two plans before the planning board, one on Magnolia Ave with an on-site wastewater treatment system, another on Cole Ave with city sewer. So those plans are before the planning board, and then they also come to the Board of Health to review as well. I'm in the process of getting up to speed on the historical practices for the review of subdivision plans, and in particular with the Board of Health's local regulations pertaining to water quality assessment. The projects on sewer, I'm told that the Board of Health has made water quality regulations, but has on occasion put prohibitions on fertilizer, pesticides, and de-icers.
We also worry about stormwater, how it's treated over the increased impervious area.
Good. And that such projects have most recently only been reviewed at the staff level with comments from the staff directly to planning board. The Magnolia project, as it's on sewer, will have on-site wastewater, not sewer, but septic. That Magnolia project will come before the septic review subcommittee later this month. And the applicant will at that time address the subdivision water quality assessment regulations.
Good.
That's new for me this month. That's pretty much what I have. If you want, I can go straight into the next one, but which is the overview of the septic subcommittee. The next item on the agenda. Let me just morph into that.
Sure.
So in your packet are the draft minutes from the septic review subcommittee meeting held December 6th. And there were 4 projects that the subcommittee is recommending for approval.
Right, exactly.
Those are in your agenda. And then there's a 5th one that we did a site visit. That's on the 2nd page of the agenda.
Right.
I don't know if you want to state them for the record,
Yeah,
each one.
okay. Let me do that.
Yeah, so we should, so Lee, you were saying we should cite the addresses from, yes, I agree. So I can put it.
Which we approve it, each one individually or all at once.
I don't know whether we have to do them individually. We can do them individually.
Yeah, I think we do do them.
Simply done. So there's a series of requests for variances to both Title V or our local on-site wastewater regulations. And all of those that I'm going to read to you have been reviewed by the septic subcommittee and recommended for approval. They include 18R Bungalow Road, recommended for approval. Claudia, you,
I make a motion to approve the 18R Bungalow Road as stated in the report.
Second,
Claudia, I call the motion now.
Oh, yes,
You agree?
I agree.
Joe Rosa
Yeah.
agrees.
Eric Kaplan agrees.
Don?
Agree.
Don't forget Marco.
Oh,
Marco.
Sorry, Marco.
Okay.
Next one is 605 Western Ave.
I make a motion to approve the variances for 605 Western Ave.
Second,
I agree.
Yes, approved.
Joe Rosa,
Eric Kaplan, yes.
Don Gannon, yes.
77. Marco, sorry.
Yes.
77 Eastern Point Boulevard.
I make a motion to approve the septic plan variance for 77 Eastern Point Boulevard in the report.
Second. Claudia,
Yes,
Joe Rosa, yes.
Eric Kaplan, yes.
Don Gannon, yes.
And Marco.
Marco, yes.
Now we got it.
And of these 4, 117 Concord Ave.
I make a motion to approve the septic plan variances for 117 Concord Street,
Second,
Concord Street. excuse me,
Concord
yes.
Street as written in the report.
second,
Claudia, yes.
Joe Rosa, yes.
Eric Kaplan,
Don Gannon.
Marco.
Yes.
And then lastly, I don't know, Eric, if you'd like to make any comment about the site visit?
site visit was very interesting and John Judd was there.
Where was the site visit?
46 Atlantic Ave.
Uh-huh.
There were a number of other people that were present also. She's sitting in the back.
Leslie. yeah.
Leslie, did you have any comment about the site visit? There's a recommendation to approve, whatever the address is, 46 Atlantic Ave as well, correct?
Yes,
The
the
John
committee
Judd
members.
gave a really good good amount of material. So do we have a motion to approve?
I make a motion to approve the new construction septic system with advanced treatment at 46 Atlantic Ave.
Second,
Claudia?
Yes, approved.
Joe Rosa, yes.
Eric Kaplan.
Don Gannon, yes.
Marco.
Marco.
Yes. Yes.
So the recommendations, all 5 recommendations of the septic subcommittee have been approved. Next item on the agenda, I believe that completes. Next item on the agenda is communicable diseases. Cindy.
You have in your reports, the communicable diseases that were reported and I investigated during the month of December. Are there any questions on that?
So what's your assessment of the vaccine clinics? Are they,
So
how are they going?
So last month, December, I had two public clinics and we vaccinated 39 people for their COVID boosters and 37 for influenza. Today, we had another clinic at the Y because we're trying to reach those 18 to 59-year-old people. And
Yeah.
I think that the senior center was not the place to reach them. And we were trying to get like after school and after work, excuse me. So we only vaccinated 12 people today.
Mhm.
8 COVID boosters and 4 influenza, plus I went to one person's home to give a flu shot. You'll have to forgive me every time I cough because I have a dry throat. I don't know if we should continue. I feel like I've got more influenza vaccine. I'm willing to, but I'm wondering if we should have individual appointments in the office and have people just come in as they would like to be vaccinated.
Rather than you just spending all that time sitting
Sitting,
there.
yeah.
Yeah. Well, one thing that occurred to me though, because, you know, it's very striking, that influenza is very high right now. And we talked about having something at the Rotary.
Yep, we did.
You know, the flashing sign,
Yep.
if that would encourage
Um,
people to get vaccinated.
Where is the sign now?
Signs down,
Just after the bridge? is it?
no, the sign that's being used is the sign that's at, on the boulevard. Because there's safety concerns about having it
Sure.
flashing at
No,
the
I meant
rotary,
the
yeah.
cut bridge.
And so it's down by
After-
that coverage,
okay.
exactly.
I,
And I don't know what the current, I don't know what it says currently. I haven't been
or
by there,
maybe
but-
something in the paper. I mean, just
We
something
have,
that brings it to people's awareness.
so we worked really hard at our Facebook, and the state believes that we have already reached our peak, our first peak. Most of the influenza that we've seen is influenza A. We could have later in the season an influenza B peak, we're not sure. But we still only have about 42% of the population vaccinated.
But that's vaccinated through the health department, but you know, oh, that's including CVS and all. of
That
the-
is
Oh,
all of
great.
Massachusetts.
Wow.
All
Oh,
of Massachusetts, only 42% of the people are vaccinated for influenza.
And they, but I'm saying they get the statistics from the drugstores and. all.
Well, what happens is every single vaccine we give goes into MIIS, the
okay.
Massachusetts Immunization Registry. And so I hope that CVS.
So no
puts
matter
in
where
there.
it goes.
No matter who gives it,
Yeah.
you have to electronically
Okay.
record it,
Yeah.
yes. So it should be
How
an
does that-
accurate number.
From your memory, how does that roughly compare with previous years?
So I think it's a little bit lower than years prior to the COVID, because last year we didn't see a lot of influenza.
Sure,
Because the
yeah.
people were still wearing masks, and the year before, still, people were wearing masks, they weren't meeting
Right.
together. This year, we kind of knew this was gonna happen.
Right.
Yeah.
So I would like to keep vaccinating. I know it's, maybe I'll do one a month and maybe continue at the Y if they let me do it there. But I felt like last time, how many people did let's see. I vaccinated at the Y, 22 COVID boosters and 22 influenza.
Oh,
This
that's pretty
time,
good.
we only had 4 flu and 8 COVID.
Mm.
So our efforts aren't, I mean, I'm happy for every one person that I vaccinate,
Yeah.
but.
And is it once a month? You did it a month ago? It was 22 and 22 and then. a
So
month
I didn't do any vaccine clinics after the 13th of the month last month. I did one on the 1st of the month at City Hall, which was open to the public, and we did 17 bivalent Moderna and 14 influenza there. And then on the 13th, we had the second clinic. I didn't think people would respond when they were so busy with holidays.
Right.
And that's why we waited until today to yet hold another one,
Mhm.
because people know that influenza's been high, everybody's been sick. We've had little bumps in our COVID. Here in Gloucester, as you can see, we have the BioBot analysis, how we've seen little upticks and then it went back down and now it's up again this week. I expect it'll do that for a while. But I don't know what more we can do to get people to come. I mean, I think that if we put it on Facebook, that people can make appointments and come to the office, let's try that as well. And I'll probably,
It's probably a better use of your time.
Use your
Yeah.
judgment, Cindy. It's,
so,
It doesn't make sense for you to just spend all that time sitting there waiting.
I know,
And if it gets really busy again, then, you know.
Yeah.
Cindy, you said 42% statewide? Not
yes,
Gloucester. You don't
statewide.
have a sense of Gloucester's.
I imagine we're probably around where everybody else is. And it's still, what I noticed is the 18 to 59-year-olds are the people who aren't really getting vaccinated. So I thought like having the clinics at the Y might hit some of those people. And we did have a couple of walk-ins today, a couple of college girls, people that had gone to CVS and were unable to get their COVID boosters today at CVS. So they came to us. So I was happy about that. And then we had a few no-shows, but just not as busy as it was prior to the holidays.
So how many staff people are there?
So it is me, and I had one volunteer nurse with me. I had one volunteer registrar, and Bree was there. So it is two of us, 2 staff members and 2 volunteers.
So that's a lot of people's time to be sitting.
But we
there.
have to be prepared.
No, absolutely, but that's why thinking about having appointments might make more sense for a while.
yeah,
I'd be happy to
Because
do
that's,
it
you
that
know,
way.
full of people sitting around.
Well, then you can do other work while you're.
Yeah,
Yeah,
exactly.
of course.
And we can reserve the conference room so that space is.
Or they can come in my office.
Okay.
Yeah.
yeah, and if people have ideas about how to get the word out, that it's worthwhile to get vaccinated.
Did you put it in Good Morning Gloucester?
Yes, we did. It was there. I don't know if recently, but we were doing it. And Carol McMahon said that she saw it there. So. Yeah.
Yeah.
And it's on Facebook.
Yeah, Lee
you
does
can
a
do-
great job on
On our
Facebook.
website.
Our
Posted a
website,
lot of places.
it was on the boulevard on that board. That's how we got some people.
Mhm.
It's on the state website, color.com. When people go look
Oh, yeah.
for a vaccine,
Mhm.
they'll see that we're having a clinic and they can sign up that way. We had 12 people sign up that way for today, but 2 people were no-shows, so.
Cindy, I would imagine your most vulnerable segment of the population, 65 and over,
Yeah.
typically.
They're-
Higher, much
yes,
higher, right?
much
Would you
higher.
say north of 80%?
Yes,
Yeah.
I would say.
That's merely my concern.
Yes,
as a
mine
physician. So 42% doesn't really inform me of much.
Right.
I'm not concerned if a
Right, it's-
19-year-old
it's-
college kid has a
exactly.
flu shot, but as long as we're hitting, we got 80% or above.
Yes,
you
and I
don't-
checked
you
with the
don't know
nursing
type-
home.
Yeah.
Actually, I checked with the nursing homes because I worry about them.
Yeah.
And everyone is vaccinated there because we only have one
So
that's.
you're north of 90%. of the nursing
Right,
homes,
right,
and-
right.
And among the elderly, we don't track that data in Gloucester to 65 and over, what percentage for the, I'm talking about influenza.
I can,
Influenza.
well, yeah, so I can look on the state website and see if I can get it as far as Gloucester.
Yeah,
But I have the North Shore, Essex County.
Yeah.
I've got that.
it is-
And that's
it's
right around the 41%.
Oh, for all ages.
For all ages, sorry.
Yeah,
I'll look and see if I can find that.
yeah, 65.
But it might be higher in Gloucester. I mean, so that's for all, that's statewide, right?
Yeah.
We may do a better job in Gloucester though. Than than some other communities.
You hope.
Getting people in. Yeah. We make it fun.
We try to make it fun. So also this week, I did reach out to the one nursing home. And I was on a call with the state earlier this week. And most of the nursing homes have seen some little clusters. And, but the nursing,
Or
no, of COVID
COVID?
and also flu. But they are doing well. The patients are recovering. They are seeing mild disease. And so it's not like what we've seen in the past.
Do you know? if
Because they're all vaccinated.
Yes.
Yeah.
Are they on Paxlovid?
Yes,
Yeah, oh, they're
yes,
getting
they're
Paxlovid,
offering
yeah.
it to everybody. However, some people are not choosing to take it, yes. So I did deliver to them more COVID test kits for their staff, more N95 masks down there, and some regular surgical masks as well. And they were very happy to get that. I also took some over to KBM PD because they were running out of masks. Seems like everyone's running low on masks now, and brought them some of the free COVID tests that we had. We received, I think we have four pallets of PPE and COVID testing equipment that Mary Ellen had ordered. And so I shared that with KBM Medical Center. So everyone's outfitted now with what they need to get through so they can order more stuff for
4
themselves.
pallets?
Yes, yep. And we've done a really great job of keeping our little boxes at the health department full of COVID tests. So any member coming in can take whatever they need so they can test for themselves at home.
Any citizen?
Any citizen, yep.
Oh, that's really good.
Yeah,
to
so
know.
we've had a lot of phone calls. We've had a lot of just people walking in. So that's going
Oh,
well.
that's really good to know. I didn't know that.
And they have them in most city buildings. I know you have
Yeah.
them in City Hall, the library.
Oh, that's really.
The
good to
team's
know.
done a great job of getting them in the hands of anyone who would
Cindy,
like
you
them.
mentioned that 2 of the people that showed up today at the Y saw the sign.
Yes,
So is the sign ideally located? It seems to me that it would be better if it were right downtown, like by the
Circle.
Chamber of Commerce, that little parking lot there.
Are we talking about the flag? You mean the
The
sign
flash,
that would?
yeah, I don't know. if it's
You don't think the
flashing, but-
Rotary is a better place?
oh, it
No,
is,
but
but they
it's
think it's not
not.
safe.
Yeah, the police aren't recommending it be at the Rotary.
Oh,
But people are gonna crash because
Oh,
they're looking
yeah.
at the sign
Yeah.
instead.
I mean, that's where the most, yeah, but,
But if you want to talk, if you want us to talk to the police about moving it like closer between the police station and the road and the chamber the parking lot that's
Yeah,
by
I
the chamber.
just think that would be,
Happy to
so
do that.
now it's on the boulevard?
yeah.
Yeah, so for people coming in, entering from 133 or,
Market basket.
I don't know how many people go that way, if you live in.
5 million people go in
Yeah.
one day.
I know, well, that's, we spoke about where her sign was outside. I go, put it up by Market Basket.
Yeah.
Everyone will see it then, that's where everyone's going.
5 million cars going there every day, so.
I'm happy to talk to them about it. Well, it's worth a try.
Yeah, well,
And then we'll talk about what it's gonna say, because if you're gonna do appointments, it'll be,
Yeah, I mean, we could even advertise that. I mean,
Yeah.
and we can put it on Facebook and we'll put it on our webpage that we can do appointment only flu vaccine.
Yeah, I think that's probably a
It's
good
not
thing
too
to
late,
try,
I
and if
mean-
you get overwhelmed, then you can have.
Go-
a
exactly,
clinic, Go
yeah.
back to the clinics.
Feeling that's not gonna happen.
Well, it's also, it's very easy to get it at the drugstores now. I mean,
Exactly.
So,
And they certainly want their share.
yeah.
They start early.
Anything else? No? Prevention, Chelsea.
Okay, well, I have 2 of my team members here, Liz Olson, again, who introduced herself, and Rosalie Castro. We also have Takia Faison, our youth development coordinator, who couldn't be here today. But we're building a really strong team, and I'm really excited. We're having a lot of great programming already in the works to serve the community. On my report, I'm gonna hold off on the healthy aging grant, because Rosalie, I know you're gonna speak in a minute about some of the seniors on the Go Bus programming, so I'll let Rosalie speak to that, because she's much more well-versed in that. I can say that for our prevention grant initiatives focused on the youth population, we've been having a lot of great connections with local and regional partners. People seem to really be at a point of readiness to expand and to partner. It seems like people are kind of, and I say people, meaning the people who are representing organizations such as the YMCA, Art Haven, Magma, Pathways for Children, the Public Library. These are all organizations we've recently met with who are really at a point where they're ready to build their capacity to serve the community. So we've had some meetings with the Gloucester Housing Authority to try to bring some programming specifically to the Riverdale and Willowwood community centers. Those are the 2 housing authority communities that have the highest populations of families and children. So we're looking to bring some programming over February vacation, possibly, although it's coming up quick. So possibly February vacation and definitely April vacation for the schools, as well as having some potential summer programming in those community centers as well. The reasons for specifically holding some programming in those locations is around equity and access. Our grants and obviously our mission as a public health department is to have an equity lens in our service. And we know that many of the families and community members who live in those housing authorities are of a lower socioeconomic status and therefore at higher risk of just have higher risk factors. So they're more likely to be exposed to substance use, mental health issues, domestic violence, and just really lack of availability of resources to be able to access some of these programs that either cost money and or require a car to get to. So we're trying to bring some programming to those communities specifically.
That's
I'm
great.
really excited about it. And they are too, like these organizations are really like excited to partner.
So can I just, you were saying they have a community center at Willowwood, and I didn't even know that. They had, and is there programming that goes on there that the housing authority
So
does?
they
Or
use,
I didn't really know there was.
yeah, so to be in full transparency, I've been to the Riverdale Community Center. I haven't yet been to the Willowwood. What I've been told is that the location of the Willowwood Community Center is very central, which is great because it's very visible. And they have historically, I think, many programs that existed were pre-COVID and then kind of fell off during COVID. So the Housing Authority is really looking to build that back up and opening their doors to agencies who are willing to partner. So I know Art Haven in the past has done, and I think continues to do. Feel free to jump in, Liz, if you want to add anything.
Art Haven has done currently, but wants to build, they're at a place where they can build some capacity, and expand their programming. So they want to do that in these centers as well.
And I think, again, Gloucester Housing Authority, they have limited capacity and staffing as well, but they have the residents and they have the space, and they are very willing to open their doors to agencies who want to come in and do some programming. The Riverdale Community Center, it's beautiful. It's redone. They just don't have the staffing to keep it open all the time. So right now it's locked behind a chain link fence and can be opened when a program is running and when there's staff there. So it's, ideally it would be open during at least business hours and anyone could drop in and use it. But families are using it. You could book it as a resident in that community and use it for Thanksgiving dinner, which we were told the family did. They have a beautiful kitchen, it's equipped, and it can host large gatherings. So families can use it for their own family gathering, as well as programming. So again, we're looking to bring in some art programming, and potentially some like community beautification projects that can serve a dual purpose of cleaning up trash and also, fostering a sense of community in that area.
So backyard growers also are they're very involved in both of those.
They are, yeah, and we've already, oh, sorry, go ahead.
No, just they would be good to partner with.
Yeah, I saw the backyard growers, like garden beds at Riverdale, and we would love to partner with them or kind of communicate with them and see what they already have in the works. So we're really excited about that, and I can explain a little more how that ties into, I know on our agenda, we have the youth risk behavior survey data. We are data-driven as a team, so we take that seriously and we make sure, and our grants require that, so that any of the programming that we do is done very intentionally and with the data and the research behind it to drive our decisions. So that programming, obviously bringing some programming to Riverdale and Willowwood makes sense. We've been partnering with the YMCA. They have very generously allowed us to tag on to some of the programming and expand upon some of the programming they have in the works. There was a 3-on-3 youth basketball tournament held over school vacation week, which was for middle and high school students. We as the grants team waived the fee for anybody who wanted to participate, who wasn't able to pay the $20 registration fee. And moving forward, we're gonna try to continue that partnership to make that accessible to anyone regardless, just make it free to anyone.
Where did it happen, Chelsea?
It was at the Cape Ann YMCA at
At the
the
Y, okay.
Glen McLeod Center. Yeah, there was gonna be another one in February. I believe February 21st or 2nd. It's gonna be during the February school vacation week. And we're looking to potentially bring in some life skills training as well for the kids. So there will be a basketball tournament, but there'll also be like a little workshop with pizza and drinks as well. Another developing initiative that we're working on right now is a partnership with Pathways for Children, trying to expand upon their capacity to offer a parenting program to the community. So they have a Positive Solutions for Families program that currently is offered once a year. We're looking to see if we can support that being run twice a year so that we can meet families' needs. That program is a 7 or 8 week program. I think it's 7 weeks with the opportunity to maybe expand to 8. That brings skills education and to support to families of young children in order to increase a healthy parent-child attachment. So we're really excited for that.
So that isn't specifically for new mothers, that's young families.
Young families, yeah. So it's more like the preschool age, and it can be mothers or father, any parent
Yeah.
who would like to attend. And again, I think opening it up there's a need for it. There's been a wait list for the program that has run once a year. And so there is a real need and an express interest in the program. Other than that, I think I can move kind of into the data conversation. We're waiting. We had a great partnership with MAPC, the Metropolitan Area Planning Council. They conducted some focus groups and key informant interviews with groups of parents, students, social workers, and teachers, and this happened in the fall. They are right now reviewing and aggregating the data, and they'll be ready to generate a report and a presentation towards the middle to end of February. We will use that data to drive programming specifically for 9 to 11-year-olds, which falls within our SORPAC early childhood grant. And that there was an identified need for additional programming for that kind of like preteen age range. And so when we get that data, we will also kind of tailor some of our programs. With that being said, before I jump to the YRBS data, I want to give Rosalie an opportunity to speak about some of the initiatives you've been working on. Does that feel okay?
Yeah, that's fine.
You're much better equipped to talk about it.
Yeah.
Thank you, Cindy.
Thanks,
I
Cindy.
didn't want her to say her keep on.
Hi.
Hi.
For those of you who don't know me, I'm Rosalie Castro. I'm the program assistant for the Seniors on the Go bus. The Seniors on the Go bus is grant funded. We rent a bus and a driver from CADA. People think I'm the driver. I'm not the driver. I'm the coordinator. So we have.
Cruise director.
You do it
Yeah, you
all,
are.
Rosalie.
So we have a schedule, and on the second Monday of the month, we go on mystery trip. So the mystery trip, the people who want to attend have to call me. They call me and they get on the bus. My bus holds 16 people, 14 will be seniors. I'm the 15th and the driver's the 16th. So they call me and we go on the bus. Once they're on the bus, I surprise them and tell them where we're going. They get all excited, they're like little kids. So some of the places we've been is the YMCA, the Cape Ann Museum, Henry's Market, Trader Joe's, Walmart. Their favorite place to go is Job Lots. I don't know why, but they just love Job Lots. Job Lots. Yeah, they want to go to Christmas tree, but that's a little bit too far out for the bus to go. So that's on Monday. And then in the summertime, well, from April to November, we walk the boulevard. So, and then people will call the CADA at that point and they'll register and we pick the people up right at their houses. Some of them live in private houses, some of them live in Gloucester Authority, Gloucester Housing Authority, Senior Center, Central Grammar. We go to Rockport, we pick up people in Rockport. So we pick them up right at their home, on Tuesdays, I'll go back to Tuesdays, we walk the boulevard. So they have an hour walk to the boulevard. And I make sure that the bus stays on the boulevard, so if people get tired, or if it's too hot, they can go sit in the bus, in an air-conditioned bus. Once everybody's back on the bus in an hour, we bring everybody home. Then on Wednesdays, we go to Market Basket, and that's the early day to go shopping. We pick them up around 8, where they're home by 9 o'clock, 9:30 at the latest. And they just go to Market Basket. Then on Thursdays, and on Thursdays, we go to all the grocery stores. We pick them up, if who wants to go to Stop and Shop, Shaw's, Market Basket, and then we pick everybody up and bring everybody home.
And this is only 14 people though, right?
Only 14 people. And for those.
But is it the same 14 people every day?
No. Basically, we have our regulars, but this week on the, for the mystery trip, we went to Walmart and I had 4 new people. And you know what? And I had 2.
They didn't know. It's a mystery.
And they come with bags, they buy everything, because, you know, they want to buy, like, one lady bought rugs for her bathroom. There's no place in Gloucester to do that. One lady bought a basin to wash dishes and soak her feet.
Same basics.
Same basin. That's what I said.
Is the bus usually full?
Yes,
Oh, it is.
yes. So, that's the Thursday schedule. And then on Friday, so in the summertime on Friday, we went to Marshall's Farm Stand, where I bought them discount cards. If they went on my bus and they went to Marshall's, they got 20% off. We used to be able to do that at the farmers markets, and now we don't have that. So we were taken to Marshall's Farm Stand, a local fish market, things around town, whatever they wanted to do. And then on the 4th Friday of the month, we go to Rose Baker Senior Center. The Open Door is there, and they have what's called the Mobile Mart. And the Open Door sets up a U, and they have U out of tables, and they have all fresh vegetables, a couple canned things, a dozen eggs, which is an expensive item now, a loaf of bread, sometimes butter, and they love it. They just come through the line, they'll get a couple bags, get back on the bus, and the bus takes them home. So it's exciting. For the Mobile Mart, they call me, and for the mystery trip, they call me. Otherwise, they call Kata, and Kata will take their name, and Kata will pick them up.
How many people are not able to get on the bus? Do you have any idea?
I'm not able, you mean physically?
No,
The waiting list.
The waiting list, so there's too many people that are vying for 14 seats.
You know what? That's never happened, because like this time, and I'm crazy for doing this, but I had like 18 people. I know 2 people are gonna call me and back out at the last minute. So, and if it doesn't happen that way, I'll get off the bus, I'll let them take my seat, and I'll go in my car. But everybody gets a chance. And if someone calls me and says, I want to go to Walmart and my bus is full, I'll say, I'm sorry, but I'll get you on the next bus. And that's what I do. I have a log that I keep.
Oh, that's good.
But I make sure everybody gets a chance. And I have to tell you, one of the things I did was I applied for Awesome Gloucester. You know what that is?
Yeah.
That's a grant that they have in Gloucester, and it's for Gloucester citizens. And you have to apply and tell them what you're going to do with the money and why you want it. So I was home at night, I saw it on Facebook, I applied, and it's $1,000. And I told them, my seniors always say, oh, Rosalie, can we go out for lunch? And the purpose of this grant is to teach them how to eat healthy and to get them out of the house. But I can't buy them food. So I figured if I got the Awesome Gloucester grant, I could take them out to lunch. So I did a presentation in December, and it was between me and another girl. She was a teacher at the Gap, and she won. So they invited me to come back in February, so I'm gonna try for that. So if I get that, I'm gonna do things like have a luncheon at the Community Impact Unit, because they wanted, like they have COPS for kids, they wanna do COPS for seniors, and I believe they're calling their program SALT. So they wanna do things with my bus. So if they're having an event at the Community Impact Unit, which is on Middle Street, I would take my bus and we'd go to the Community Impact Unit to do event there. So I thought if we do something like that with this Awesome Gloucester money, I could have a luncheon for them there. And because I was the former food inspector, I know all the restaurants and all the chefs. So I would go to all the restaurants and I would talk with the chefs, see if they could do a couple special healthy meals for us and serve it to the people, and then come out and teach the seniors how to cook these special meals at their house. So that's another thing that I'm excited about, and hopefully I get it this month.
That's fabulous.
Yeah.
That's
So
great.
you want to
Yeah.
tell them about the anonymous donor?
And then Lee told me that there's an anonymous donor that donated, they heard that I didn't get accepted this time for the Austin Gloucester. So they want to donate $1,000 for me to use to take the seniors out to eat. I haven't seen any money yet, so. But when I get it.
And
you'll
thank
know
you
about it.
to whoever the anonymous
Yeah,
donor
I
is.
know, thank you to the anonymous donor, no one will tell me, so that's what I have in the future for my bus, but I love this job, and the director told me, Rosalie, this job was made for you, and I've been doing it for 3 years. And during COVID, it was a little bit sketchy and it was hard, but we pulled through it, and it's a great program.
And didn't you tell me you took them was it one night to look at lights or?
At Christmas
At
lights.
Christmas light- I
We
thought
didn't
that
get-
was great.
They loved it, and this year we were going to take them out on the trolley. Kata was all excited, but there was a storm on that night and it was too icy, so we had to cancel. So maybe 2023 we'll do that.
So if I would think that there would be more seniors if the more they know about it. I mean, could you ever do like 2 buses a day, you know, if more
Kata,
people wanted to come?
Kata has told me that if I have a lot of people, they will give me a larger bus. My
Oh,
bus is decorated and it says seniors on the go and it has bumblebees on it, so you know it's us.
Mhm.
But Kata has told me that if I have a lot of people, they will. And they bill me monthly. So I'm sure if it's a larger bus, I'll have a big
That's
bill.
rather than 2 separate.
Yeah,
Yeah.
yeah, yeah, yeah.
Yeah, oh, that's great.
Yeah. Yeah.
I would think more people would want to go.
Well, you know, I've advertised, this is a copy of one of my schedules. I've gone door to door in every of the Gloucester Housing Authority building. Every door I've left a schedule. I've gone to the senior center. I have advertised, at least put it on Facebook.
You
So-
talk it up all the time.
And wherever I go, I have my materials with me and I pass it out. I have COVID tests with me. I'm on the job 24/7.
You have always been, no matter what the job was.
Right? My
You
son
were.
said, "Ma, when are you gonna stay home and knit?" No, no, that's not for me, Jeremiah.
Right. But then you retire
Yeah.
once, that's
Rosie,
Yep.
what's your email address?
At work,
Whatever you.
okay, it's R.Nicastro at Gloucester-ma.gov.
Thank you.
Thank you.
You can offer, well, I don't know what you can offer, but suggest to your 14 attendees that they bring a friend next time.
I know.
Mm.
You know, that has happened. I have one girl and she brought her 2 sisters and they're like friends this past Walmart. So, yeah, so the next event will be the Mobile Mart. And for the Mobile Mart, I don't go on the bus. I go on the bus for the mystery trip. But on the Mobile Mart, I don't go on the bus because I work at the senior center helping distribute the groceries. But the bus comes with my people.
It's great.
Yeah. So
Great
that's it in a
job.
Yeah.
nutshell.
Rosie.
Thank you very much.
And
Thank
that
you.
funding
Thank you.
is through June, right? And then we're.
Yes, that's funding through June, so we're going to start to try to find someone to help. Excuse me, support our bus.
So we can make it sustainable beyond June.
Yeah,
So why did the funding end? It's,
the grant is over.
it doesn't renew.
No,
It's a state grant. the city-
It has 2 more years. It's a Healthy Aging Grant, Massachusetts Healthy Aging Grant through HRIA. It has 2 more years beyond this June,
Yeah.
but the funding for the actual bus itself ends in June. And the intention is to make it sustainable so that communities can adopt better access to transportation for older adults. So that it's not reliant on grants. Like, I believe that's the intention of that
right, we
grant.
tried to see,
Sustainable how? Right.
we tried to see if the city would support the
Yeah.
bus,
Mhm.
or through the senior center. The city would support it through them, their budget, and then the health department would pay, the grant would pay my budget. I would continue to run
What's your
it.
yearly budget? Which budget? What's your budget?
How much does the bus cost?
Well, the bus is between 3,000 and 4,000 a month.
Oh, I guess.
And I must make 20,000 a year guesswork because I'm only part-time.
Well,
So
you're
4,000.
24/7.
So
A lot of in kind.
let's say
It's a grand a
75,
week. It's a grand a
100,000.
week for the bus. It's $1,000 a
Yeah,
week for the
yeah,
bus, right?
yeah.
And that goes to Cape Ann Transportation Authority.
Correct.
They're public funded though, aren't they? They're not
No,
private.
they're private.
Are they private?
No, they're a regional
No.
transportation authority. They receive,
Privately owned?
no, well, privately operated, public, they receive funding through the state. Regional transportation authorities funding.
So we thought we would start calling people, see if we can get somebody to donate. Support us. Right?
Yeah, it's important to be aware that this is such a
Maybe-
valuable service that,
Senior care,
Yes, you need 50 grand a year just
Just
for
for
the
the bus.
transportation, and
Right.
others are included.
Is that a GoFundMe page?
could we?
I don't know, as
No.
city
I don't know.
employees, if we're
City
allowed to
thing?
do that.
I got in trouble for Brian.
Yeah. You didn't get it.
How
Because
else
city
are you gonna
employees, we're
sustain
not
it?
allowed to.
How else are you gonna make it sustainable? That's what I'm asking.
Yeah, no,
Well, we're gonna call people, see if they'll help us, like call senior center, the senior center, they do a lot of things. The Friends of Seacoast, see if they would help us, the Friends of
Friends
Rose
of-
Baker.
Friends of the Council on Aging. So this is,
Council on
they
Aging.
So
brought
have
this-
some kind of a fundraising event. What about having a fundraising event?
So they did bring this to the, as part of the budget request in FY, what are we in, FY 23?
Yeah.
And, but also through the senior center was brought to us non-emergency medical appointment transportation, because that was also funded on a grant, so. And the city said you have to make the decision on medical appointments or, I love it, don't get me wrong, nobody
No.
loves Walmart more than my mom. So anyway, they're funding decisions that are made at that level and the number of people who are being served, so.
And that, what they gave the Rose Baker Senior Center wasn't a lot of money because they already have a bus.
Yeah.
So I don't have a bus, I have to rent a bus and a driver.
So we're
So-
trying to figure out how we can use the resources that are already at the senior center to fulfill the goals of this program as well and make it sustainable over time. So for this fiscal year, which was the first one that was brought to this administration, the priority was non-emergency medical transportation.
So I
And they
think,
had funding through this June, so.
how about having Fred Cowan? Isn't he like the chairman of the council, friend of
Fred
the
has heard
council?
me cry. 'cause,
Doing some kind of a big fundraiser.
I'm on the board with Fred and he's heard me cry at every meeting about my program, ending in June because people really like it and
Oh,
it'll be
that's great.
sad to see it end.
Well, and
But
so
I
the
could see him doing a fundraiser. some
I
kind
would
of a
help him.
fundraiser.
And
I
the
would help
Friends of the
Okay.
Council on Aging is really the fundraising arm.
Uh-huh.
And that, so that's another group that we should definitely.
Yeah, that's a good idea. I'll talk with Fred personally and say
Yeah.
between him and I. Thank you, thank you. I'll call you for the fundraiser.
Absolutely.
We go way back, me, you and Fred and Joe. Thank you.
Thank you.
Thank you.
The last piece, I think, on the prevention team agenda is the youth risk behavior survey. So I believe you all got a summary of the findings in the packet. I can go as in-depth or as vague or just succinct as you'd like. I think I'll give just a brief overview of kind of some key points, and then I'm happy to answer any questions. And if the board would like me to do a more in-depth presentation, I'm happy to do that at a future date as well.
Yeah. I think that would be a good idea, but I'd also like to hear your top level thoughts about what we're learning.
Yeah, so as you might have seen again in the summary of findings, just as an overview, the Gloucester Youth Risk Behavior Survey was administered in the spring of 2022. It's been administered on an every other year basis in Gloucester since 2003. And it's for all middle and high school students. It's based off of the CDC's National Youth Risk Behavior Survey. So there's some core questions that are really pretty standard, and then there's some room for individual communities to select additional questions that they feel are important for their community. So for Gloucester, there were some additional new questions that were added in 2022 for this survey, which you can kind of see. For new questions like stress, for instance, there's no trend data across years because it's new for this year. For mental health in general, we pretty much across the board saw an increase of reported mental health issues. An increase since.
Yeah.
Say that again.
I'm not surprised.
Yeah. I don't think most people are, and we've heard, COVID created a lot of additional challenges for young people and families. So for instance, in high school, 37% of high school students reported experiencing depression. 33% of middle school students reported experiencing depression. We have seen, again, so on the concerning side, mental health is up across the board. On a positive potentially note, we've seen rates of substance use decrease since the last administration of the survey, which was in 2019. You'll notice there's a 3-year gap between the 2 years of administration. That's due to COVID. So there has been a dip across the board of substance use, although the context of this being administered during a pandemic, we need to also consider rates of or ease of access, and then also the social conditions. Usually often youth use substances in social groups, and there were fewer groups gathering. So I wouldn't be surprised if at the next administration of this survey, the rates go back up to what they were prior to the pandemic. That's kind of like the real big overview. I'm happy to go into more specific questions.
I don't know if there's a question in this regard, but it's an issue. Mental health issues have been predicted to be high in the schools, and sure enough, they are.
Yeah.
What probably hasn't changed very much is access to care.
Yeah.
And so is there anything you can comment about that?
Yeah, definitely. So I can say that the schools have done a fantastic job under the superintendent and Amy Cam's leadership in increasing the social support, the social emotional support, the mental health supports in the schools across the district. They have not only dedicated adjustment counselors and trained mental health clinicians. They consult with Lynn Lyons, who's an expert around anxiety and school avoidance, who consults with their clinical team. They also have a lot of training that staff receive just across the board. So any staff member has a base level of support and mental health knowledge, so that they can not be a therapist, but they have a concern about a student, they can refer that student to the appropriate support. So the schools themselves have a pretty impressive array of services to meet the mental health needs of students. What we know is that it's not just a school issue, it's a community issue. And so some of, as our prevention team, we are not just focused on substance use prevention, we're focused on mental health support. So a lot of the programming that we've been doing and we're looking to implement are around supporting mental health. Because we know that when people have good mental health, they are less likely to rely on substances as a negative coping mechanism. We're looking to implement teen mental health first aid in the 10th grade in the high school, which would train all 10th grade students across the board on how to recognize signs of a peer or themselves who may be struggling with a mental health issue, and how to get that person to the appropriate supports. It also would require training 10% of the high school staff to understand that and kind of be like an ambassador for that program, so that if a staff member has a concern about a student, they can also connect with any of those trained staff members. And they don't have to be, again, they don't have to be guidance or adjustment counselors. It could be a custodian or a teacher. So we're working to get the teen mental health first aid. Again, we know that when people feel connected to their community and they feel like they have social supports, they have better mental health outcomes. So a lot of the programming that we're doing, again, is looking to increase access to pro-social opportunities, particularly with a lens for vulnerable populations. It's not, in this summary of findings, the data isn't broken out by subgroup, but we do have data broken out by subgroup based on gender identity, sexual orientation, and racial categories and ethnic categories. And across the board, we see much higher rates of mental health issues and substance use issues for students who identify as LGBTQ and students who identify as gender non-conforming. So either transgender or gender non-binary, or I think other, or exploring. We also see much higher rates of depression, substance use, and suicidality in racial and ethnic minority students in the schools. So we need to both, be available and create programming that's accessible to the whole community while also really making sure we're targeting our most vulnerable populations. So again, in one example of that, how we're paying special attention to those populations is, again, bringing programs to the community centers at Riverdale and Willowwood. And making, the basketball tournament free of charge to anyone, no questions asked. I know Unity is an amazing organization that a lot of LGBTQ+ youth feel comfortable accessing. We're trying to partner with them more to see how we can expand and what their needs are. So how we might be able to bring some programming or expand upon their capacity. And then again, lastly, parent support, right? So it's youth are part of a family. We are all part of a family. So when we're looking at supporting youth, we're not looking just at the kids themselves. We're looking at the whole family unit and their whole social support network. So when parents feel supported, kids have better mental health outcomes. Again, which is why we're focusing on the Positive Parenting Solutions program to help parents feel better equipped to be emotionally available to their children and to feel confident as a parent. And
I think, I just want to say, having Lynn Lyons come to speak to parents was excellent. And that was a pretty good turnout. And I mean, just as someone who was just there, kind of, it just seemed like the parents were getting a lot out of it.
That's
And
amazing.
so that was a really positive, I thought that was a really positive way to support parents.
I did too. I love listening to her speak, and we are so fortunate not just to have her be able to give presentations, but really to have her as a consultant to the schools is huge. So yeah, that's all that is Amy Cam's doing. But we're lucky to be able to partner with her.
We're partnered, I mean, the health department partnered. with
We
this.
did, yeah, and we had a really great resource there that I think contributed to such a high number of attendees.
Yeah, the turnout was amazing.
Yeah.
That was great. I also just want to say, I thought it was really interesting in that the part on school connectedness, that 77% of kids said that they felt there was one adult in the school that they could talk to if they had a problem. I thought that was a really high number.
Yeah.
And that I think that speaks so well of the schools. Like you said, even if it's the custodian, that whoever, that they felt there was someone.
Yeah.
77, it's a high number.
I agree. I thought that was a real high point, and ideally one day we'll get to 100%, but 77% is high, particularly again in the context of COVID, when kids were not always consistently present, in school, when school was partially remote. And so I think, having a trusted adult, ideally one trusted adult in school and a trusted adult out of school is really shown to be the most powerful protective factor against issues like substance use and mental health disorders.
I would make one other comment, that we're lucky we live in Massachusetts, because there are a lot of states that for LGBT kids, it's a catastrophe.
Yeah, I agree. We're very lucky. We have a very,
We have a supportive government.
yes, from the top down, a really supportive government that values mental health. I will say the only other thing that reminded me is regarding mental health access, brand new starting this month, Elliott Community Services is now the holder of the contract for mobile crisis support. It used to be Leahy Health that provided mobile crisis mental health support. It's now Elliott, but they have really expanded upon the supports for mental health access. So they are going, I think they started to open a center in Salem, but that serves the whole North Shore region, where anybody can go and call and get an evaluation. The intention is to, an evaluation and connections to not just mental health support, but they have financial assistance, they have parenting support. So it's a very comprehensive and wraparound. And one of the goals is to obviously meet the increased demand for mental health.
Do they have to go
support.
to Salem, or Is it,
They can do some satellite work here in Gloucester. I'm still learning. It's brand new. I think they're rolling it out and they're working out the kinks for some of the tangible, like financial support, even like diapers, for instance, like they could deliver diapers to Pathways for Children and have that be an access point. But I think they might be able to offer transportation to the Salem location. I'm trying to remember, I watched a webinar about it. But the goal is to keep people out of the emergency rooms, which are inundated.
right, I was just gonna say, because it used to be when there was a crisis, if someone called, that's where they would meet, that's where the crisis team would meet the person in the emergency room, and because I know as a therapist, where people didn't want to go there. So
Yeah,
people wouldn't go, because, I mean, it was not at the appropriate place. If someone's having a mental health crisis, to be in a emergency room, in a waiting room, emergency room. So
yes.
I hope they are doing something different.
The goal is to partially address that's one of the main issues, is like to avoid that, because again, emergency rooms are not a calming, trauma-sensitive environment for people who are undergoing a mental health crisis.
Yeah.
And they are overwhelmed with medical needs. So again, it's brand new, but the goal is really to try to meet the increased demand for mental health services. So we'll see how it goes, but it's a good step in the right direction.
Thank you, Chelsea.
Thank you so much.
I just want to say, just before we go any further, it's just very impressive to see all of you working so hard and doing such a great job, and being so committed to the work that you're all doing. I
Thank
really
you.
appreciate it.
Thank you.
Thank you.
Thank you.
Here, here.
It's nice to hear. Thank you.
Absolutely great.
So let's
Do we
move on
want-
to old business.
So Joe, in the past week, the staff has, has not had to
They-
stay
they
if
can.
if they want
Yeah,
to.
but they can.
Yeah, I just have, they know, they
Yeah,
can.
okay, just. so
It's
you
been
know.
discussed.
Oh,
Thank you.
Yeah, we've been here since 8:00.
I kind of want.
But if you're into tobacco regulations in Good Harbor Beach.
We are.
Waiting for this
All right.
for months.
I'm gonna stay with the tobacco regulations.
So we're down to old business, and the first item under old business is the Good Harbor Creek pollution issue. And I just want to introduce it by saying that this issue arose because the department and the board, in satisfying its obligations and responsibilities by state code to test beaches during the summer on the order of weekly, for the presence, for physical safety, as well as for the presence of noxious bacteria such as enterococci, which is correlated with disease in humans. And in the course of that testing, if the test results exceed the statutory limits, the department is required to post no swimming, swimming may cause illness. And we have done that. And in an attempt to fix things, we've turned to the Department of Public Works, and they've done a lot of work that our fearless leader, Joe Cahill, will try to elaborate on.
Sure, thank you. So I'll start by saying, I am not a scientist, so if I get these words wrong, so I'm gonna probably avoid the scientific terms here, but I can tell you what we've learned and what this city, under the leadership of Department of Public Health and Department of Public Works, as everyone here knows, in 2022, Public Health worked with a consultant, Woodward and Curran, to undertake a bacteria source investigation along Good Harbor Creek. What I think probably less people know is that previously and essentially simultaneously, DPW has been consistently doing their own investigations as part of their larger work to improve an aging sewer infrastructure across the city, but in this area in particular as well. I'd probably say a few months ago in the late fall, the consultants came in and gave a presentation that myself, the mayor, Joe, Mike Hale, the Director of Public Works, Mary Ellen Rose was there as the Director of the Health Director. And I should thank Dan Ottenheimer. I know Dan has been an incredibly huge help for the team to try to understand some of this work. And Leslie joined us for that as well, and Title V sanitarian Leslie Whalen. So that report will, and I should preface this because I think there's probably most of the people waiting on the calls, waiting to hear this. So that we did receive the report. The reason that the report on its own is difficult to release is because there is a lot of science in that. And so that's why the presentation is valuable. And I'm sure as we move forward, more presentations will take place. The short version and what we learned is that we need much closer collaboration between sharing of data from the health department and DPW. And that's something we'll see going forward. And they essentially identified, but really the recommendation is you need to do more studies, right? And you need to in order to really pinpoint where it's coming from, you need to keep looking. But we do know that from kind of the Bass Ave, Thatcher Road side, that it appears to be coming from the sewer infrastructure. There's a potential that on the towards the Rockport side more, it may be more animal and possibly avian. As we know, there's lots of birds, nests on Dover Beach.
Yes.
So next steps, right? So from this presentation, and again, the full report with the summary memo and the memo that will be going from me to the city council and CC to the Board of Health, you guys will get that all tomorrow electronically, as well as city councilors, and it'll be put up on the website so everybody can read as much as they'd like. So we met internally last week, sometime in the new year. Again, Leslie, myself, Joe, Mike, Mary Ellen, and the mayor talk about next steps. And I think Joe alluded to one of the most important ones is that we know enough to know that there are sewer infrastructure problems. And so the further investigation of where the exfiltration or infiltration, that's happening within the infrastructure, that the leadership of that will move over to the DPW to discover, pinpoint more whether it's lining of the pipes, whether it's old pipes. And I don't know the difference of the pipes as well as maybe even Leslie or Mike do, but you can read a lot about that in the report. So DPW will take over the leadership of that investigation. Public health, and I should add that at the recommendation of your board chair, DPW is gonna start testing again this winter. So to see as many trends as we can identify, right? Because the other piece of information that we definitely got out of this report that we suspected was it's high intensity, short duration precipitation events is when we see the numbers increase. Yeah, exactly. So I will say there was no smoking gun in this report. So anyone who is waiting to be like, wow, you're not going to get it out of this. But what it is setting us up to do is really narrow down where the infrastructure investment needs to be as you look across the whole city. So DPW will be taking the lead on that. They're going to gather the data through this winter as well and share that with the health team so we can start to build a larger data set. And what we expect that will tell us, and what we think the public should expect in the swimming season is if we have a high intensity precipitation event, we will likely be closing swimming at the creek in anticipation of the testing coming back. Because one of the concerns out of the mayor's office is if we test on Wednesday and we get results on Thursday and we close the beach on Friday, what do we really know? We know it rained on Tuesday, right? We don't really know what it's like. What's that, right? When the people are in the water. So, so we're trying to come up with ways that we can predict when a closure would be most important, and where the DPW should really focus their work on the infrastructure. And with the Board of Health and Department of Health, we'll go back to their regular seasonal testing, and really paying attention to the strict guidelines that are prescribed through the State Department of Public Health through their regulations on what the Department of Public Health's role is on testing, reporting, determining closures, and things like that. And the piece that I really want to stress is the collaboration between the Department of Health, the Health Department, and DPW. We're starting a work group. Leslie will be a part of that. The water team and the engineering team out of DPW, conservation agent, to keep all the information that's coming together, right? Because the conservation might find something more about the migratory birds that we don't know about, right? So keeping that conversation going so that all departments are on the same page, right? Because the public likes to call DPW, they say go call health, they say go, so sharing that information so all the departments have the same message going out to the public. Because communication from the mayor's office perspective, communication around this issue has been one of the biggest problems, because it's been different depending on who you're talking to, and because of the timeliness of it, right? Because it changes so often. So working on improved collaboration and improved communication, both internally and externally, are two of the important next steps. And again, DPW kind of leading the way on the infrastructure improvements, and the health department continuing their regular beach testing and reporting.
Yeah, I think it's worth, if I can just elaborate a
Absolutely,
little bit
please.
on what Joe has said. The study that the city paid for said it was likely that there were deficiencies in either the stormwater drains or sewerage. And both of these systems in East Gloucester are really old. They're the oldest in the city. And so DPW has continuous maintenance and repair operations ongoing, quite apart from being told that there may be a problem leading to enter a compact. There's ongoing work that's always being done. And it's possible that the work that's been done over the past, 6 months or a year, has corrected this problem. But it's winter now, and creek testing is less conclusive in the winter because it's cold weather, bacteria don't multiply as much, so you don't really know what you've got. But nonetheless, DPW is gonna start doing those collections and testing, so at least we'll have some data. And so it's not as though this problem has gone away. And it's also true that work has already been done that hopefully may alleviate it.
I think it's great that it's a team approach, that it's become a team approach. Even the Conservation Commission being on it, with, as you said, the migratory birds or whatever, really people putting their heads together with different perspectives, trying to figure this out, because it's so important that it get figured out in some way. I know that's how I get stopped on the street all the time.
Yeah,
you know.
well, and Leslie, having Leslie on board and the planning team too, it's also, let's take a look at the new development in the area. Maybe there's something we're missing there, right? Because there has been a lot of change in that area. So there was nothing super conclusive about the report, but I think what it did, at least for this team, this administration and the team we're working with now, is really spur the collaboration and look at it through multiple lenses. We will continue some work with Woodard and Curran. We'll probably wait until the next director to decide how we're going to continue with that contract. And then DPW, Mike also has a civil engineering firm that he'll be working with to do some further investigation into the pipes. And again, I might not know the answer, so I may turn to Leslie. If it's science, it goes that way.
Do you know if any of the infrastructure, federal government infrastructure money can be used to help the DPW fix our sewer system?
The larger sewer system in general. Well, so we're working through that now. So we know we've already invested, as I think everyone knows, 10 million in infrastructure going to the wastewater treatment plant of the Federal American Rescue Plan Act funds. And we're working with the congressional delegation right now to figure out how and where we can get into some of that infrastructure money. We did just get another 2 million. Thank you to the Senator Markey, Senator Warren, and Congressman Moulton. Another 2 million from the feds to go to the wastewater plant. So we are there. They know that our biggest infrastructure need is aging sewer and water infrastructure. We have 400, we're 400 years old in
Just gonna
2023,
say,
so
yeah.
guess how old some of the pipes are, right? So, yeah, so we're working really closely, and they know that our team knows that the federal team knows that that's our number one priority, so. If we can get it, we will.
I hope Mary Ann is still listening, you know, and that she got. to
She is
hear-
still on.
Oh, that she got to hear that.
Yeah.
Um,
She is still on.
She's been really a great.
She has, she's
Cheerleader and,
keeping us on our toes.
yeah, showing up and waiting and listening.
Any other comments?
No, it just, again, sounds like. it's
And I
a
guess the
really-
only other thing I'll add is, and it's in this memo that you guys will receive, as well as city councilors, I know there's some on here. That this interdepartmental task force will then report to the mayor's office so that we can provide you guys updated reports as things go on. And, you know, this also highlighted a piece that we talked about, is that there's a lot of other water and sewer infrastructure that has that we've accomplished recently. One is did I say it right when I say CSO over at Pavilion Beach is now closed. So there was still moving things through
Right.
pipes out around Pavilion Beach. I think Bree had the pleasure of having to close Pavilion Beach on a hot Thursday or Friday last year. It is now down to zero flow at that location. So there's a lot of work that's being done that we don't do a great job of talking about because we're busy.
Not too many people
Yeah.
interested in it when it doesn't cause a problem.
Exactly, until someone can't go to the beach. So that's another piece that we're gonna work with our communications team to make sure that we get some of that information out. So we expect some better test results at Pavilion Beach this summer.
Thank you.
Yeah, thank you. Thank you for having us.
Finally.
So is Joyce still here?
Yeah.
Poor Joyce.
And Joyce, why don't you take, I'll sit back there.
Right up front.
Yeah,
Right up front.
yeah, come right here. We'll switch seats. It's literally getting hot over there. The heat's on.
It is. I feel the heat. So hi, everybody. If you haven't met me, I'm Joyce Redford. I'm the director of the North Shore Cape Ann Tobacco Policy Program. And I've been doing this for 25 years as of January 1st. So my first thing to tell you all is that I apologize for the length of time it took to get me here. And part of the reason is I don't do all these updates myself. We have our team at MMA and MHOA who help with, you know, templates and language, etc. And the last thing that occurred here in Gloucester happened on September 22nd. And I was on the call, but I did not know that was the reason why I was on the call. I thought it was about another issue. And so I had brought up on that call that I was concerned about this amended language. For those of you who don't remember, any applicant who failed to apply or obtain a tobacco permit pursuant to section E12F. These regulations may be eligible to obtain a tobacco sales permit, provided the applicant demonstrates that they have complied with Commonwealth and our regulations and so on. And I had mentioned then that if we have a cap and we have somebody out there who's selling tobacco or nicotine, and we don't know about them, then what happens? Like, do we just give them a permit? Do we not give them a permit? And I think the sense was that they didn't anticipate that would happen. Well, I would just share with you that recently in the city of Lynn, we got notified that a barber shop was selling vape. And of course, they'd be compliant. They'd never have failed a compliance check because there never was one. You know, they didn't do anything wrong because we didn't know they were there. So both on my recommendation and the recommendation of MMA's attorney, and if you feel it's important for you to run this by the city solicitor, I would encourage you to. But she and I both strongly agree that this should probably be rescinded, because as it is written right now, anybody could be selling tobacco in the city of Gloucester and not have a permit. And we wouldn't know it because the way we keep track of who's selling is that they have a permit. I would also just to add to this,
prior to Max leaving, so I think it was his last meeting, the board agreed to do a 7-day suspension when there's a, no, 3-day suspension when there's a sale to a minor. But that was never captured. It was captured at the meeting, but it was never entered into the regulation. And the regulation that was put before the board to add this to it was dated back from 2016. So I was totally caught off guard and confused because I wasn't consulted. Did I have anything updated? I had no idea. So the regulation you all were looking at was enacted in March of 2016. There has been an updated regulation that occurred and was enacted in May of 18. Additional update in August, enacted August 1st, 2019. And one that is not.
Sorry to interrupt, but is it true that, I'm trying to remember now, I actually looked at all those, but is it only the 19 that has the cap?
Yeah, that it's
I
listed,
think so,
yes.
Yeah.
Yeah, 'cause I remember when we voted on that, yeah.
And so the cap is in the 19 one, and the 3-day suspension is not in any that we have as a draft. So my first thing to let you know is the cap is 36, and we only have 31 active. So there was no need for this anyway. We still had 3 open permits.
Oh, really? We thought
There's
that,
31.
yeah, that it was.
That's
And
why,
that was the one unique situation.
that's why this all,
Okay.
you know, adds up to, this doesn't have to exist.
Okay,
And so the other issue is the one establishment that we thought, or perhaps never had a local permit, did
I
have
had
a
a state firm.
did have a DOR,
Yeah.
and this is their history. We have been checking them since at least 2016, and we changed databases, so we may not have captured that. And correctly, the establishment had never had a violation until the time that it rose to that level, and she came and appealed it, and then through some exploration, they thought she never had a permit, which she may or may not have, but she was never off our radar. She wasn't equivalent to that barber shop, who we had no idea existed. She's been checked, she's had education visits, she's had compliance checks, both from us, from FDA, and they've all passed with the exception of that one. Her issue is resolved. We concur that we have 31 active permits. City of Gloucester and mine are in a line. There's one duplication, but that's not uncommon. So you have 31 active. So prior to moving to a draft like tonight, I will tell you, if you took a look at this draft, many of the things that are highlighted in green are decisions that Gloucester has already made as far back as 2016, which means very little heavy lifting if we decide to move forward. A couple of things I'm going to recommend, and I'll do them in order of, so the 3-day you voted on, the 3-day suspension, so the next official regulation will have that in it, hopefully with some of these other things. One of the decisions the board would have to make is no permit renewal for outstanding fines that exist. So if they haven't paid their fines, there shouldn't be a renewal. Or that's what it says. You can make that decision. It saves the health department a lot of legwork in terms of chasing after people who aren't getting these things paid. The next one is no permit renewal for 3 sales to a person under 21 within a 36-month period. So no renewal basically means you put them out of business because for that amount of time, they continue to have what we consider egregious violations. The cap is 36. You currently have 31. Well, actually, let me just double check that. Is it 36 or 37? 36. You currently have 31. I would recommend that if you move forward, the cap be reduced to the number of active permits you currently have. And that was the whole idea behind a cap, is through attrition to lower that number.
Yeah, that's what we had talked about.
Yeah, and that keeps the, you know, if I'm selling my business and tobacco is part of it, that's a safeguard for me, because that permit can be shared, not shared, but given to that establishment.
It can be passed on.
As long as it's done within 60 days.
I
Joyce, can I
think several of
interrupt? I
those
think they're
things are
looking
in two thousand nineteen.
I was gonna say, there's a list on the front if you guys are trying to flip through, right? These are
Yes,
what you're
yes,
going
yes,
through.
that's what I'm going through, right, I'm sorry. And you are right, so moving forward, I'll point out the ones we already have. So then you have a cap, but there's two kinds of cap we can do. You have a simple cap, it's a number, doesn't mean if, it doesn't matter if it's adults only or a regular convenience store or liquor store or whatever. So the town of Danvers and Ipswich and I believe PVD are going to enact, well, they have enacted, PVD is considering it. The retiring cap, which means if a business goes out of business and it didn't exchange ownership within 60 days, that permit would come back to the town and be retired and would be down by one more. And then potentially putting a cap on adult only versus, like, we're only gonna have 2 adult only max at any given time. And then just of a regular retailer. So these are the ones you'd be considering. No new permit within 500 feet of a school. I'm not 100% sure if that one's in there, but I have a sense it is, or we weren't worried about it because where the schools were located, there wasn't one when we
They're
visited.
moving.
Yeah, exactly, exactly. And there was no place for development for a convenience store or something. No new permits within a certain distance from another establishment. And that would be moving forward because you may have, and you do have, 2 across the street from each other in certain places in the city. So that would be moving forward, there wouldn't, but that would still also be through attrition because unless that establishment was vacant for so many months that, then it would go on. Abandoned smoking bars, you already have it. So no heavy lifting there. Including minimum cigar packaging pricing, you already have it. Blunt wrap ban, you already have it. Ban on free distribution of tobacco products, it's already in your reg. Redeeming coupons, already in your reg. Self-service display, already in your reg. Educational institutes, already. Now, the finding structure, it currently is that blunt, 2 things right off the bat I can tell you is blunt wraps and cigar pricing and packaging are exclusively local regulations. They're not in the state law. But you have the option rather than do a dual finding system. So if today X variety sold to a minor, it would, and they had no record, it would be $1,000 fine and a $3 suspension of their permit. If in 6 months I went into the store and their cigar pricing and packaging was off, or they had blunt wraps on the shelf, it would be a second violation, 7-day suspension of their permit, but only a $100 fine. So you can opt to say all the components of our regulation are going to be under the 1,000, 2,000, 5,000 delineation. That's an option. So that would be something the board would consider. Tolling periods for local violation, you have the same, you already have that, it's 36 months. Suspension periods you've already ironed that out, 3, 7, 30, and they shall be, it's not a wiggle room. And with the state, you can't, there's not an option to change the shall anyway. The one place where may comes into play is if you have, and unfortunately, we have, in the last 3 months, there have been 3 establishments, 2 of them constituted as adult-only establishments, not here in Gloucester, just within the collaborative. The violations were so egregious that the cities, there were 2 separate cities, revoked their permit to operate in their community. And it included, we get notified of, if the FDA is out there and does compliance checks, we get notified if they failed. We don't issue any fine on that. We don't take action on it, but we do keep a file. So if, X establishment has a history and they've had an FDA violation, a violation with us, and the feds, MDOR has gone in there and seized product because they're in violation of, they're not paying their taxes or they have flavored product. We're aware of those things, maybe not instantly, not the next day, but we're getting them pretty regularly. And that also played a part in what happened in those establishments. We did a joint inspection at one of the establishments because there were so many parental complaints about them selling flavored product to underage youth. We went in there in a joint inspection with DOR, and we removed 1,000 units of either flavored or untaxed products. And the same thing, a parent called, turned in this establishment in Peabody. We went in locally, did an inspection, found 2,600 units, contacted DOR, who arrived on scene and seized that products, and they have been revoked. Another one in Lynn is on their very last strand to do the right thing. And so that just, at that point, you all decide how egregious or, you know, what point you want to take, what step you want to take. You want to say, we're just going to do another $5,000 fine, or do we think it's so egregious that we want to potentially revoke or suspend longer than 30 days? That's your opportunity.
So Joyce, thank you for all this work. This is amazing, and having it at this table is very useful. I have one concern about how we retire permits.
Okay.
And that is, I actually wrote it down here because it's a little bit confusing, and I may get tongue-tied if I try to say it myself. So I believe that I've been told that there are several individuals that own multiple convenience stores in Gloucester.
That is true.
And they all have tobacco sales permits.
Correct.
Those stores are valuable in the community. Hopefully not because they sell tobacco.
Yeah, not
for other
exclusively,
reasons.
right?
They're
Exactly.
They're the walk to convenience store where you buy milk and bread and whatever.
Correct.
So it's obviously in Gloucester's interest to keep the stores, but to regulate their tobacco sales and certainly not have them selling to minors.
Mhm.
However, if one of these multi-store owners decided to leave because, I don't know, taxes are too high or whatever, for some other reason, right? The current regs would require their permits, unless they were reassigned to a new operator within 60 days, they'd be retired. Those permits would go away.
Exactly.
60 days is too short.
Okay. You can determine, or you all can determine that.
But that should be a discussion of.
Right, absolutely, but I understand what you're saying, and you can also not adopt a retiring cap. If you think 31 is reasonable and you want to continue with, like, let's keep the cap at 31 and revisit this in a year or 2 years, and if we've lost a couple stores, it's like, well, they've been vacant for 2 years, so we'll put the cap down to 30 or 29 or wherever you're at. That's entirely up to you. Those are just like your options.
Okay.
So I think the whole struggle is with us about wanting to decrease,
Yeah, it's a
accessibility to
balance of.
tobacco, because
issues.
we know that it's a health concern, and that was, I think, the idea.
But the point
Yeah,
is
no, I
also
see.
complicated by the fact that if these stores lose their permit, they're not going to reopen because too much of their value is in selling
Oh, if
tobacco.
they lose, that was, if they lose their permit because of a violation.
No,
Oh, I know what
because
you
of
meant.
60 days.
Yeah.
If the permit is retired and
Oh, I
we're
see.
at max, they can't get a permit.
They
So
can get away
who
with,
would open the store?
you'd either waitlist them, which we have. We have
Yeah.
many, waitlisted until one becomes available. But if you shoot, let's say, forget the same owner, what if it's just a different owner? Any owner says, I'm trying to sell my store, and I'm going to leave the store, vacate the premise. And what you're saying is if it's vacated for 60 days, that person is already gone.
Mhm.
They vacated the premises.
Right.
It's just not an opportunity for another somebody to come in and start up a new business that sells tobacco. They could still have a convenience store, they could have food, they could have all the other things,
Right.
but not a tobacco permit.
Right. But tobacco sales, like it or not, are
Yeah.
important to. the
Well, they're
fight.
the value of the person selling it, not necessarily if it's been vacant, the person coming in, because we don't know who that person is. It could be someone who has no interest in it, but that's entirely up to the board. And, we're giving you the strongest options, this is tobacco
It's what
control.
you do.
Yeah, exactly, it's what I do. But it doesn't mean you have to go the strongest route. And I just wanted to point out that you've always been ahead of, or on top of what, was relevant and important and current. And at least, at the minimum, I want to get the most updated and the correct language in there, because this was a struggle to find all this.
Yes, right.
I believe it,
Well-
by the number of pages.
And my first thing is, you had an emergency meeting to adopt this.
Yeah, that was meant to be an ad hoc decision to not penalize someone who we think was acting in good faith.
Yes, and I would say, I would agree that she was, but you don't need this because this opens the door for too many other potential.
So what we actually did is we kind of changed the regulations.
Yeah, and you
to
can
suit that.
rescind this.
Yeah.
Yeah.
And then it won't go into the new one, and it would be, nothing will have changed. Nothing will have changed prior. You didn't make it, it didn't matter then, and it won't matter tomorrow.
Right.
And I would say if there's any of these, like, let's say you have a vote tonight, you don't even have to, it doesn't, I'll come back next month, I'll be here, God willing. You can take time to look at this
Yeah.
and decide what ones are, you're like, oh, we're totally on board with that, or this one's a question and let's work it out, and then we'll create a draft, and you can go to public hearing and make a legitimate new regulation with an enactment date.
Right, right.
So, and this checklist for this, these are the questions.
Yeah, and
I
these
mean, they-
appear typically in green, but
Yeah,
maybe
yeah,
not
yeah.
entirely
Yeah.
throughout the document, right?
Yes, but you
This
guys
is
have
what we're addressing.
just so you know, you already have, so the only ones you're really looking at are number 1, number 2. You already have number 3, so then 3 is kind of resolved. You can decide about a dual cap of retiring, so that's like kind of a question, but you do have a cap.
Reducing cap or retiring?
Retiring cap, yeah. New permits within 500 feet of a school. I honestly am not 100% sure that's in here, but I can certainly look at
I
it.
think it is, but
No new permits within an existing establishment that already sells. Retail is like this because it kind of cuts down the competition, being a stone's throw away. It would not hurt any current existing establishments. But moving forward, a new establishment couldn't be, like, something that was an ice cream shop can't become a convenience shop if it's a convenience shop that's across the street from one that already exists, at least in terms of the permit, the tobacco permit. So that's not decided. And then from there on, 6, 7, 8, 9, 10, 11, 12, 13. 13 is still a question about your fine structure, so that's in question. But 14, 15, 16 are all addressed. So you're really only looking at like 5 decisions that the board needs to make. And it makes it really simple because that's captures the work you've all done over the years.
That makes it a lot clearer.
Yes,
Yeah.
right? You're like, oh my God, are we dealing with 17 things
Yeah,
or
exactly.
5?
so do one of you, Marco, one of you 4 want to come to the next meeting with a proposal that seems reasonable, just as a starting point that we can discuss, as opposed to starting from scratch and discussing everything again.
And if
Joe's
someone
looking
wants
for
to-
a staff member, we'll talk internally tomorrow too, and at the meeting on Wednesday for who on this team.
Yeah, yeah.
And I'm
Should be the
happy to
most
join that to, like, in case there's any clarifying questions that need to
Sure.
be answered. I mean, it makes
But
sense.
you're available on email, right?
Yes.
So you don't have to
Or,
trek back and forth.
no. Actually, my GPS got me lost coming here. So I'm happy to do that if you guys want to.
Okay, good. So, Joe, were you suggesting that the staff do?
We'll talk tomorrow and then we'll meet with you on Wednesday like we do on who internally here, but I think a board member, it would be important to have a board member.
Yeah.
Help lead the way on that.
Have a volunteer.
What day is it?
Well, we can pick whatever day works for somebody's schedule. If you guys tell us who it is, we'll make it work.
Well, you don't have to, I mean, you can communicate via
Email,
emails.
yeah, doesn't have to be in person.
So we're writing your back down?
Yeah, sure.
Great.
Oh, that's great.
Good.
And then the only other thing is, did you want to address this section of the?
Yeah,
Yeah.
for sure, yeah. I mean, as I said, my understanding was that it wasn't meant to be incorporated in perpetuity. It was meant for that specific instance.
Except I think we thought
Right,
the only
right.
way that we could
We
do
did it
that
incorrectly,
Exactly.
probably,
was to
yes, right.
make it. a
And it was
regulation.
because the information, you just didn't have all the information in front of you, so I understand.
Okay. Where are we at? Are we done?
Do you want to make a motion to rescind this? Because it was adopted.
Right, well,
Why
we
don't we do it
certainly
next-
can,
yeah,
if
we can,
that's,
or next
that's
time.
useful to do. Would someone like to make a motion to rescind the, what's the name of it? Does it have a name?
It doesn't, they just said what
The
section it is.
addendum of such and such a date.
Done on September 22nd, that I know. That was adopted on September 22nd, 22.
So,
Someone
well,
willing
Don,
to
if
make
you
such a
have-
motion?
Since you have it in your hand, or do you, I
He
mean,
just wants to read through it.
oh, well,
Do you want me to read, you need?
no, I mean, I'll make the motion that we rescind the
Amendment of-
amendment that was made on September 22nd,
22nd of 2020.
2022.
Second,
Perfect.
any discussion?
Yes,
Marco, any discussion?
No.
So,
yes,
yes,
Yes.
Yeah, rescind.
yes,
Yes.
it's done.
Perfect.
So we, for anyone paying attention, this is an amendment made on September 22 of, September 22 of 2022 to the tobacco product sales regulations.
And Lee, I'll send this to you tomorrow. Like, I'll send you that it was rescinded. This is the language that's gonna, and then, once we have a decision on what a draft will be, we'll all be on the same page.
concern of the board.
Thank you for your patience.
No, 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 and you for, I mean, mine, I wasn't available. And Lee has my email address, so thank you all very much.
Good to see you.
Thank you.
You too, very nice to see all of you.
Thank you.
Nice to be in person.
So the last item on the agenda is concerns of the board. Claudia, I know
Yeah,
you-
so I just wanted to formally say that I'm retiring. After the February is my last meeting. I've been on the board for more than 18 years and it's my time to be renewed. And so I talked to the mayor and Jill and said, I think at this point, I'm going to step aside and let somebody younger, hopefully, step in and, it's been an amazing journey and I've enjoyed well, I can't say every moment. of it. There were some rough times that made it difficult, but for the most part. So I'll be here next month and I'm still happy to be a volunteer. I told Chelsea I'm happy to work with the prevention team as a volunteer. If there's ways that I can be helpful, using my skill, my MSW training and expertise. And also, I don't know if you want to say anything about the search committee.
Oh, yes, the search committee for a new director. I believe, Claudia, you're willing to participate in that interview committee and Don?
Take it.
did
Like,
you-
just like old times.
Okay, great.
And so Don and Claudia will be part of that group. Along with, I think we should keep, with the addition of Jeremiah DeCastro is willing to participate. He would be a good addition, but we had,
And
I
I'll
can't
reach-
remember now.
I'll reach
Well,
back
Jill-
out to myself and
Yeah.
then I'll reach back out to Amy Camp from
Yeah,
the
yeah, she'd
schools
be good.
and Peggy Hegarty Stack was the other community. Because the work that this department does is so integrated with the community.
So
that's-
what we did is we had initial interviews, just a few of us.
Yeah.
And then
Right.
when we had.
The
two
second
or-
interviews.
Yeah, the second round.
So the
we-
three of us will do.
Yeah.
We'll lead through the first group
Mhm.
and then we'll bring in the community members.
So
Um,
the committee, this Board of Health or the subcommittee that's gonna be on this will recommend to the mayor who,
Well,
is that how it works?
so we went from, so how we did it last time was we started with the big pool, we decided the three of us, and if you guys decide you want Jeremiah in that group too, we're welcome to do that. Whittle it down to a group that then moves to the next interview that we bring the larger group to. That recommendation came to the board, the full board, and then the board makes the recommendation to the mayor,
The candidate.
the candidate.
Of the final candidate, yeah. And just to say, if it goes beyond February, then I will go from being a board member to a
To a
volunteer
community member,
Yeah.
that works.
to continue to.
That's great. You're,
Yeah.
both of you, thank you in advance for
So
your
like
time.
you're getting paid.
Exactly. Either way, somebody asked me if I was gonna get a pension.
Yes.
All right, anything else?
Motion to adjourn?
Second,
We have to vote.
Yes.
Marco, adjournment?
Adjourn.
Yes. Joe, yes.
Eric, yes.
Yes. All right. Can you shut everybody off except Marco? You can't do that.
No. Well, no.
Okay. Marco, we'll email you tomorrow about
Okay,
future meetings.
all right. Thank you all. Have a good night.
Feel better.
Right,
does he have
exactly.
COVID?
Sorry?
Does he have COVID?
Just sit
No,
in
no,
and
he
feel well.
thinks he has the flu.
Either way, we don't want it. That's why I was
Yeah.
like, yeah. Her cough sounds.
So Jill, I don't know whether you